Armanyous. I'm a consultant psychiatrist and I'm the clinical lead for Huntington's disease service in Fife, and I run the management clinic. So perhaps you might ask why my mum or dad will be seeing a psychiatrist. I think you probably know already that one of the symptoms of Huntington's disease is changes in the mood. Some people feel a bit more irritable, more snappy, more short-tempered. And we see some patients feeling quite low in mood, lacking the motivation to do things, lacking the interest in certain activities that they used to enjoy in the past. So one of the first things we do is to assess their mood and ask questions about how they have been feeling on a day-to-day basis, ask questions about how much they enjoy certain activities, how much they enjoy time with family, and also we ask questions about their sleep and their appetite. These questions will tell us whether we need to help mum or dad further with the mood, and that could be through discussion around giving them medication like antidepressants or seeing a psychologist to do some therapy. The other thing to remember within mood is we assess for anxiety. A lot of patients we see have raised anxiety levels. They worry a lot, worry about the future, worry about their families, worry about their finances, and sometimes these worries can affect the way they sleep, the way they behave, and they can't sit and relax. Again, we can give medication for that or use some types of therapy to help people manage their mood and manage their anxiety better. So that's one thing we do in our management clinic. One other thing I need to mention about the mood is it's not uncommon for people, perhaps when they are first diagnosed with Huntington's disease, to think in a very negative way. Think like, what's the point of life? What am I doing here? Is this worth living? And this is something that we assess for, because these thoughts are not uncommon and they can make everything look negative. There's help for that, and through this assessment we think with the patients about the best way of helping them maintain realistic approach to their illness, their future, their families, and all the activities that they could think of. And as you probably know, Huntington's disease can affect a number of systems in the body. So you will see that we ask a lot of questions about so many different things. For example, we'll ask questions about patients' ability to swallow, questions about the mobility. Can they walk on a straight line without having to lean on walls or use sticks? We ask about falls, we ask about movements. So we ask these questions and also use our observation in clinic to assess the mobility and the movements element of Huntington's disease. We might ask mum and dad to stretch out their arms, to walk up and down in the clinic, things like that, but really very minimal testing. And let's not forget that a lot of people find these symptoms hard to cope with. So a lot of people would resort to unhelpful ways of coping, and this is something that we also ask about in our management clinic. Some people resort to alcohol, some people resort to smoking excessively or taking drugs just to feel calm and escape the news about Huntington's and the symptoms that they might be observing. So we ask these questions to help your mum and dad develop better coping mechanisms and also work through any habit that they might have formed in their attempt to cope with the symptoms. So how do we do this assessment? One thing is we ask questions that can tell us a bit about how things are, about the mood. But the other thing that we do as psychiatrists is we observe the way our patients present in clinic. We observe the way they talk, we observe their body language, we observe the way they behave in the clinic, we look at their eye contact, we look at how they engage in a conversation, because that can also tell us about their moods. It's not just about questions, but also about observations. Because we know that within Huntington's disease, one of the things that can be affected is the memory. It's the ability to recall certain events and certain things, perhaps that happened quite recently. And also the ability to organize and plan. We find patients becoming quite impulsive, so they act without a lot of planning or a lot of thinking. Why do we do that? Because that will inform us about what care package we can have in place to support your mum and dad. What is it that we need to be mindful of to make sure that this problem with the memory isn't affecting their day-to-day life and isn't making them unable to do things that they would enjoy. And I think one of the beauties of working within the Huntington's disease service is that we work as a big team. So I can't cover everything in one clinic, but I rely heavily on closely working with the Huntington's disease specialist nurse, who will have more information about the development of the illness through seeing mom or dad more often. I will have close relationship with our occupational therapist if needed, our psychologist, and I also inform the GP of everything that I've been through within the assessment. This is particularly important because one of the things that we look at in our management clinic is medication. So we review what medication our patients are taking, whether it's for Huntington's or for other illnesses or physical health problems like blood pressure or diabetes. So we do a quick medication review, and if we're recommending any medication, usually this is done and prescribed through the GP. So one of the other things that we also cover in our management clinic is what we call capacity. And by this I mean, as you know, as the disease advances, we see that patients lose the ability to think and make decisions for themselves. It could be that they lose the ability to think and make decisions about their health, about their medication, about where they should stay that is safe for them, or about their finances. So we assess that every time we see our patients. And if we feel that our patients aren't able at one particular point to make these decisions, then we have to think with the family and social services about the best way to help our patients make decisions in the best interest. So you're coming along with your mum and dad to the management clinic. What is it that you could do to help them? These clinics can be quite frightening for some patients, particularly those who have never seen a psychiatrist before or never seen a doctor within the Huntington's disease service. So one of the things you could do is to be mindful of that and help them feel that this is about them and about the best interest. It's not about making decisions on their behalf. It's not about forcing them to make decisions. It's actually about thinking with your mom and dad about the best way of enjoying life, feeling and being safe, and also managing the illness. The other thing is, we mentioned about memory problems. So one of the things you could do is, if you have any observations, if you've noticed something that is concerning you, or if you have questions before the appointment, or mom or dad mentions something and they say, I would like to talk about that when I'm in the clinic, I would advise you to make a note of that, because it's very common, not just in Huntington's disease, it's very common that when you go to the appointment, you forget totally about any question and all the questions that you had in mind. So my advice would be to keep a note of all these questions on your phone or whatever way you prefer, and bring them along to the appointment and we can address those. And my last thing is, if you've noticed something yourself that is concerning you, it would be a good opportunity to mention that, whether it's to the doctor doing the assessment or the Huntington's disease specialist nurse. You can just mention that and feel that this is all about your mom and dad, and we'll take that seriously and work with it to make sure that we are making the best decisions. Thank you for watching.